everyone. Thank you to Horizon for allowing me to be back again. We've done this for, 8 years, I think it is. So a lot of changes over those 8 years. Can everybody hear me back there? Okay. Generally, my wife says that I talk too loud, so, Well, I appreciate that. I've had a swelled ear for 2 weeks, so I apologize every now and then, especially as we get started. I'm coughing yet. I can't get that to move out until I talk for a little bit, so I apologize. My name is Keith Leitzen. I am the owner of a company called Managed Care Partners. Managed Care Partners works with rural hospitals in 7 states, helping them to manage their risk of the insurance companies. So we help them negotiate, we help them fight claims, we do a lot of various things. And the one item that is near and dear to my heart is this. Every year I do these educational programs. And this is very important because this year there's a lot of change coming, a lot of things that are different for next year. We're going to go through some of those. I want you to ask questions. This is not lecture time. This is you ask a question. You didn't hear something I said. You're not sure what I said because I have a tendency to talk fast. So if you miss something, stop me, okay? Excuse me. What you have in front of you in that packet is not what's going to be on the screen. So you may want to you will want to take some notes. You'll want to do that. What's in front of you is a packet that literally my staff put together at 5 o'clock this morning because Medicare just released the information at 5 o'clock this morning. Okay? So technically October 1st is the start of annual enrollment. But October 15th is the actual enrollment date. That's when you can start making changes. Okay? So that's what's important. And we're going to talk about decisions. We're going to talk about when you sign up, how you sign up. We're going to do a deep dive into what are the alphabet. What does A, B, C, and D mean? What is the difference? What's the comparison between original Medicare and Medicare Advantage? We're going to talk about Medicare Advantage enrollment because it's different. And not everybody understands that. So we're going to go through that. We're also going to go through the major changes in Part D. Part D is always the easiest part to remember. Why? You're a great audience, okay? Stands for drugs, all right? And then we're going to finish up by talking about the various ID cards. Lovely insurance companies have made that a little more difficult the last couple of years. I can't blame it all on them. I get to blame most of it on Medicare. So, one of the most important things we were advertising, we were asking the hospitals to advertise and put in their marketing this year was about the annual notice of change. How many of you received your annual notice of change in the mail? How many of you even know what that is? It's a packet of information. It tells you, if you have a Medicare Advantage plan, it tells you all the changes. If you have a straight Part D drug plan, not Medicare and You, thank you. Medicare and You is a separate book. But the insurance companies are required to send you that annual notice of change. And that's the key because of all of the changes for Part D, you were supposed to have had that over the last 2 weeks so that you could study it. I've had people say they haven't gotten them yet. The insurance company. So whether it's Humana, WellCare, United, Aetna, they should have sent you a packet. And it's a packet. It's not one letter. It's a booklet. And it goes through, here's last year's premium, here's what your new premium's going to be. D. Okay? Or if how many of you are Medicare Advantage right now? Show of hands. How many of you have Medicare Advantage right now? We'll count. Okay. So the majority of you are original Medicare. Okay? And that's why we're doing this. Because 50% across the nation have Medicare Advantage. Locally, it's only 30%. Most rural communities are 30% or less. So how do we get to 50% across the nation? Because Medicare Advantage was designed for the cities. It was designed for Chicago, St. Louis, Los Angeles, New York. It wasn't designed for Paris, Illinois, or Marshall, or Charleston, Mattoon. Okay? Go out to Wyoming. You know, what's rural?
Can you explain what Medicare Advantage is?
No, in a moment. So, great question. Hold on to it for 10 seconds. Okay? All right. So, the decisions start in September. That's what that annual notice of change was supposed to have come out. October 1, today, is when you're able to see everything at Medicare.gov. How many of you are enrolled or have a username and password at Medicare.gov? About half. Your job when you leave today is to take your grandchildren and have them help you set up a username and password at Medicare.gov. Okay? Medicare.gov has everything about you and about the plans, and you can find just about anything you want at Medicare.gov. 10 years ago, I would have told you to stay away from it. Today, that's not the case. They update it constantly, and it's very, very good. The enrollment, notice I said enrollment, not open. Annual enrollment is October 15th to December 7th. There's a big difference between annual and open. Open enrollment starts January 1st. Open enrollment is only for those members who are in a Medicare Advantage plan and need to change, who want out. So annual enrollment, open enrollment, two totally different items that unfortunately national advertising on TV continues to get it wrong, continues to say it wrong, even though Medicare continues to slap their hands. Who's got the money? So Medicare enrollment, across the top, there's different phrases. Initial enrollment period. That's when you're turning 65. General enrollment. That's because you missed your enrollment. So now you can enroll under a general enrollment. But you can't do that until January 1st. So if you miss it, your birth date's in September and you didn't get it done, you're without Medicare until they get it approved sometime between January and March. So that initial enrollment period is extremely important, isn't it? How about annual enrollment? Just what I was talking about. That's the Medicare Advantage enrollment, not your supplement. Your supplement is based on your date of birth. How many of you knew that? Nobody. You did? You're a star. No. Open enrollment. We just talked about it. January 1 to March 31. Medigap open enrollment. There we go. From the month of 65 birthday until 5 months after. Special enrollment. Anybody know what that is? That means you move to another state. Move to another county. Moved into a long-term care facility. Not a assisted living. Long-term care. Question.
Yeah, I mean, you explained that beautifully, but I'm a little bit confused here where I fit in. I'm 60 to start with, just turned 60 August 1st.
Mm-hmm.
And I have Medicare, Medicaid, because I'm disabled.
Yes.
So which bracket would I fit?
None. Because you are Medicaid.
Okay.
So in Illinois, your Medicaid is also making you eligible for Medicare because of your disability. Okay? So this is all about Medicare. So you don't fit that until you turn 65.
Okay.
So when you turn 65, then that first column is where you start over.
Right. Okay.
Okay? Great question. Great question. Other questions? Sir.
So I'm almost 67.
Okay.
I haven't ever signed up for Medicare. I'm still fully employed in the state of Indiana. What category do I fall in? And should I sign up?
So when you turned 65, you did not enroll in Part A. You, January 1, need to get on A. Okay? Even if you're working, notice the second part up here, still working past 65. So I'll jump to that because that's what the question was. When you're working, you still need to sign up for A. A, you earn over your lifetime. You do not pay an additional premium. Okay? Notice my phrasing. You earned A. Not given. It's not free. You worked your tail off. Okay? So I constantly talk to people about that. But from 65, now, are you going to retire next year? Okay, that's the key. You need to enroll in A so that you're enrolled. Okay? Because it doesn't affect your group plan at all. All it's going to do is put you in the system and give you a red, white, and blue card with your new number. It then gives you access to Medicare.gov. Because without that red, white, and blue card, you can't enroll in Medicare.gov. Okay? So, when you're still working and the employer has a plan, that's fantastic. In a small business is any employer less than 20 employees. Okay? So if you're working for an employer who is more than 20 employees, that's what applies up here. But again, because of A, and you're turning 67, enroll in A. Okay? Now, you should not have a penalty because you've been insured. If he had not been insured and hadn't enrolled, what happens? Penalty, penalty, penalty for the rest of his life. Okay? No. A. He didn't enroll when he was eligible for A. Okay? So they can penalize you for A also. Okay? Now, he won't because he's on the group plan.
I had a client come in and we talked to Medicare, like we called them,
Mm-hmm.
and they was telling him when he's going to retire. They told him that since he wasn't going to retire for another 6 months, that he didn't have to get his A, he could wait. I thought he was supposed to get it.
My recommendation is when you turn 65, enroll for A. Okay? It just makes things cleaner and easier for you as you go forward. Okay? Yeah. Yeah. Yes.
Now, if you enroll in A, does that mean you're covered for hospitalization?
On a secondary basis to your group plan.
Okay, so the first one pays Medicare.
Correct.
Gets in.
Correct.
They're
Because
like the Medigap at that point.
right. To some extent. Yes. Was that the same question?
Same question.
Okay. Okay. Now,
So in that case,
whoop.
Medicare is part of the Part B plan.
No. Hold that. Hold that. Okay. I'll go through that in just a second. Hold that. Because that's a great, the way you said that is important.
I have federal government, doesn't work with the federal pension. I can still have their insurance.
Right.
And I also have Medicare A and B.
Right.
And
That's fine. Yeah. Because the Fed, your federal plan is overriding.
secondary.
Right. Right. Okay. Okay. All right. So bear with me a moment on that. All right. Now, something else that's very important that we've not talked about a lot, but because of Medicare Advantage and the issues that people are having, I want to talk very briefly about guaranteed issue. Illinois is a guarantee issue state, meaning you cannot be denied as long as you enroll when you are supposed to. So if you're turning 65, you need to enroll. That's the point. That's the guaranteed issue. It's also guaranteed renewable, which means you cannot lose your coverage as long as you do what? Pay your premium. Exactly. Okay? They cannot take it away from you. Can they change your Medicare supplement on an annual basis?
Yes.
No. Medicare supplements are locked in stone. I was just telling someone that nothing is cast in concrete. Okay? It's not cast in concrete, it's cast in stone. Okay? Because the supplements do not change year to year. Medicare Advantage can change year to year. Okay? Because that's driven by the insurance company, not Medicare. Okay? You'll get it a little bit more. But that's the key with that bottom bullet there with Medicare Advantage. Benefits can change year to year. So they can change your co-payments. They can increase your premium. They can take away dental insurance. They can make it harder to get the coverage that you want because of the rule changes that they make. Can't do that in a supplement. A supplement is a supplement.
Define supplement.
One second.
Okay.
Illinois law, guaranteed issue state, birthday law. From 65 to 75, the date of your birth, you can make a change in your plan. So you could go from United to Humana. Same plan G, same plan F if you qualify. Okay? But it's now a lower premium. Guaranteed. Are the insurance agents telling you that? The majority of them no, because unfortunately, most of them don't know this. Now, I'm not faulting the insurance agents, because insurance agents were taught, I've been doing this for 40 years. That's why I have all this lovely white hair, where I have hair. Okay? 40 years, nobody focused on this. Because insurance agents, in the past, you came in and said, I'm turning 65. They said, here, sign this. You're in Plan F. You're done. Because Plan F was what? It paid everything. It's a 100% plan. The government took that away in 2020. Plan, and you can keep it. As long as you can afford it, keep it. Plan G is identical to Plan F, except you have to pay the Part B deductible, which currently is $240 a year. Not at least. The deductible cannot change. You can have co-insurance, but Plan G pays that on your behalf. So no, you cannot spend more than $240. Now, if something has gone haywire, and you can ask several of these ladies in here from the hospital, mistakes are made. Medicare.gov. You can print your claim data right out of Medicare.gov. Very important. Okay? Sir.
I'm a little confused. So the birthday law is, only applies to Part B.
No. Applies to Medicare supplements or Medigap. That's not Part B. It's Part A and B. Hold on. Hold on. Very quickly, Indiana has similar rules. How many of you are here from Indiana? Couple. All right. I'm going to be doing another session in Indiana 2 days from now. Okay. The key to this is it's very similar, meaning that you're still guaranteed issue, and they have a birthday rule. Their birthday rule just has a shorter time frame, 63 days, rather than the 5 months that Illinois does. Okay?
Can you go back one?
I can try. Hold on. There we go.
I'm gonna be 75 next year. What do I do about that?
If your premium, you technically don't have to do anything. If your premium that you're paying is affordable, everybody has a different affordability, right? So if it's affordable, you don't have to do a thing. But some people, it's not affordable. So they want the same coverage. I still want Plan G. Notice I'm saying plan, not part. Plan. Okay? I can go and find companies that will charge me less. Same identical coverage, but it's less
I
premium.
can't remember, is G or F the one with no deductible?
F is no deductible.
That's what I have.
Okay. And F is continually going up. Okay? It's going up faster than we want. But that's because there's no new people coming in. Okay? So we're in a trap of, as people age and get sicker, then we have to pay for that difference. Okay? So that's why Plan F in some cases is not a good thing. All right? All right. Now, whoop. Oh. All right. So, now let's start answering some of the questions about Medicare Advantage. You have 2 roads. Those roads are going in the same direction. Okay? I don't care whether they're going north, east, south, or west. They're going in the same direction. But you have Medicare Advantage as my right hand. You choose to replace my left hand, original Medicare, with Medicare Advantage. Medicare Advantage is the insurance company that you choose to work with. So it's Humana, it's United, it's Blue Cross, it's WellCare. Okay? Medicare, original Medicare, and a supplement is over here. These roads are never going to cross. They're never going to merge. You cannot have both at the same time. I repeat, you cannot have both at the same time. You're one or the other. That's the reason for annual enrollment. Because at annual enrollment, you can leave Medicare Advantage and go back to original Medicare if you want. Okay?
I'm sorry, I have a question. So, with everything that he said and what I was looking at on my cards, I should have the original, and that's great. But when you just said with the Advantage, you choose your companies, I constantly get mail from WellCare.
Time out again.
All right?
Because of your Medicaid, 3/4 of what I'm saying doesn't apply.
Okay.
Okay? Medicaid in Illinois has what is called MMAI right now. MMAI is a Medicaid Alignment Initiative. It has been out since 2014, so the last 10 years. It was an experiment that the government thinks worked. Starting in January 1 of 2026, there will be no MMAI. It will all become a dual special needs plan. I'll go into that later. But that's why you're getting that information, because they want you working with Meridian or Blue Cross Community Plan or Humana, okay? Or Molina. There's 5 companies. All right? But that's Medicaid.
Okay.
Okay? So again, 2 roads, you make the decision. Original Medicare parts. That's the key. A, B, and D. A, hospital. B, outpatient. D, drugs. Those are the 3 parts. Okay? C is Medicare Advantage. C is Part C. Now, the main difference is Parts A, B, and D are based on the type of coverage. It's care. C replaces A and B, and in a lot of cases, D, because you will have a Medicare Advantage plan that is all in one. Okay? But your Part C may offer extra benefits. Not everybody needs or wants those extra benefits. But that's part of the reason it was created. So, because original Medicare, remember I said to the lady, you can't change your supplement? So I can't add dental to her supplement. She can buy a separate dental policy, but I can't put it together with your supplement. Okay? Where Medicare Advantage, I can put those extras, build those extras in. Okay? But you cannot have a Medicare Advantage and a supplement. Remember our roads. You're either one road or the other road. You cannot have a Medicare Advantage and a separate Plan D. You can have it together, embedded. It's called an MAPD, Medicare Advantage Prescription Drugs. Now, this is part of the reason this is confusing. This is part of the reason why we do this. Okay? So questions? Because I see some blank stares at the moment.
Is it still under Medicare Advantage plans that you don't get to go to any doctor you
That's
want or any hospital you want?
That's correct.
They tell you who you have to see.
That's correct. Okay?
And it's cheaper than the other one, correct?
Not necessarily. Okay. There's a difference between cost and out of pocket. I'll explain that in a moment. I'll explain in a moment. So, again, let's continue. Original Medicare, you can buy any 10 standardized gap plans, supplements. So Medigap and supplement is the same thing. Okay? Back in the 60s when Medicare was created, they were called Medigap because you're filling in the gaps. Plan F filled in all the gaps. Plan G fills in most of the gaps. Okay? But again, Plan F only available if you were born So it's your birth date falls before January 1 of 2020. So somebody turning 65 today, next year, cannot buy a Plan F. Okay? You can also have a high deductible Plan G. A high deductible just means that you're reducing your premium but absorbing a $2,800 deductible first. So now A and B are both subject to that same deductible. That make sense? Some people like that because they'll go from $130 a month premium to $50. But they just took on that risk. Okay? I had a friend of mine a few years ago, he's an attorney, okay? Because he was an attorney, he did well. He could afford that $2,800 until 6 months after he did it, he found out he had cancer. Okay? We don't know what our life is going to do. So we have to make decisions based on what we have. Is a high deductible plan good? For some people it is. They can afford $2,800. That's not a bother, especially when they reduce their premium by 70%. Okay? You can also use an employer plan, the lady that was on the federal, okay, as that gap plan. State of Illinois employees. My wife is retired, I'm not. I'm on the State of Illinois plan, the same as I've had for the last 10 years that she was there. But she is not on Medicare Advantage or a supplement. She's still using the state plan because of me. Finally got her back.
So when she retires, what happens?
She's retired.
Oh, okay.
She's retired. She retired at 62. Okay? But until you turn 65, you're not eligible for Medicare. 62 just means I can take money. Okay? 65 is when you qualify for Medicare. All right? Now, Medicare Advantage is a PPO. It's an HMO. It's a private fee for service. It's an SNP, special needs plans. Depending on the county, if you look in your booklet, okay, Illinois, your two counties have like 30 plans available. 30 plans compared to 10. Indiana, I don't remember if it's Vermilion or Vigo, I forgot this morning when I looked at it, has 53 plans. Who's going to look at 53 plans? Okay? You're trading an insurance company for original Medicare in Medicare Advantage. And if you need prescriptions, then you want to have it embedded because, again, you cannot buy it separate. You either have it included or you're without. Now, there are some people who will buy a Medicare Advantage without drugs. Why? Veterans. Veterans Administration. Easiest one. Because they can get all their medications from the veterans. Okay? So, again, your specifics come into play. To answer your question about can a Medicare Advantage limit who I see? Absolutely. Right now, Humana is losing hospitals and doctors by the hundreds. Not in Illinois, but in many other states. Humana isn't reducing coverage or availability in Illinois. United is. United has some counties they've pulled out of completely. So if you have a United plan and you're in that county, Greene County is one, way on the other side of Illinois. Okay? United dropped a bunch of the plans out there because they said they weren't making money. Medicare Advantage is, I'm sorry, I'm gonna say a bad word. Medicare Advantage is about profit. Sorry.
And it's not your profit.
No, it's not. Definitely not my profit. All right? So Medicare Advantage, you're jumping through more hoops. You have to make sure that your hospital participates. You have to make sure your doctor participates. Many years ago, I was doing one of these, and this lady sitting in the front row started crying on me. And I had to stop the meeting and find out what was wrong. And she had been talked into a plan. She didn't have a doctor within 50 miles. She was 80 years old. She didn't drive. Okay? She was having troubles getting meds, everything. That's the point. Know what you're doing. Which road is best for you? It's all about you.
So let's say that they are signed up for Medicare Advantage at the beginning of October, or when the open enrollment ends.
Right.
That doctor and hospital can stay through the next year.
No. Great point. Thank you for bringing that up. I got to have some plants in the audience. Key is, that's why open enrollment starts January 1. Because you could sign up now, and suddenly in December, you get a letter that says your doctor just retired. You don't like the SOB that's in there with him. Okay? So you're not going to go there. So what do? Well, I either got to find a different Medicare Advantage plan. I got to find a different doctor. Maybe I go back to original Medicare, because what happens in original Medicare and a supplement? 99% of all hospitals and 95% of all doctors participate. Okay? Huge word, participate. Not accept. What does accept mean? Can I have your card? That's accepting. I'm accepting his card.
Oh.
What does that do? Nothing. Doesn't mean that it's going to pay. Participation means that the doctor and the hospital are participating with the insurance company to abide by the rules that Medicare establishes to pay your bills. Okay? That's why the word participation is so important. Okay? Now,
Medicare Advantage is still what we call in-network.
correct. Medicare Advantage is all about participation. Correct. Medicare Advantage is all about participation in network. Okay? Yes. Yes. Everybody's so impatient today. All right. Notice on here, I'll stop for 10 seconds. If anybody wants a copy of this, when we're done today, put on I've got a bunch of paper. We'll put on a note, your email address, and the staff will email this to you. Okay? Or they'll print it and mail it to you. Because there's so many pictures and everything in here, it's hard to send to people because it's so big. Okay? All right. Questions, participation, original. Okay, I got 15 minutes left. That's going to be tricky. Pay me now or pay me later? How many of you remember the Fram oil filter commercial? Pay me now, meaning do an oil change so you don't have to replace the engine. Original Medicare, pay me now. I'm going to pay a set premium so that my Plan F pays 100% of everything when I go into the hospital. Pays 100% when I see the doctor. But I've got a set premium. Medicare Advantage, I also have a set premium, don't I? But what is it? In a lot of cases, it's zero. But the difference is I'm going to have a copay for everything I do. Now again, that copay might be zero if my doctor participates. But I still have a copay. Remember I said Medicare Advantage, original Medicare, Part B $240 plus my premium, plus my Part B premium, Part B, okay, which right now is $174, right? That's my only expense. That's it. Okay? Somebody starting out today, turning 65 today, will spend across the state of Illinois roughly $300 a month for everything. A, B, D. Okay? Medicare Advantage, yeah, I might have a zero premium, but I can spend up to $9,000 or $14,000 because that's the federal cap. Okay? Now, I don't know about you, but $9,000 seems a whole lot more than $3,000. Okay? $300 a month.
Yeah.
Times 12, $3,600. Okay? Which road am I going on? What is right for me? That's the importance. I'm not saying Medicare Advantage is bad. In some cases, it is fantastic. Okay? I have a group of ladies that I advise every year. They're all rapidly getting in their mid-80s. And I have several of them swear by their Medicare Advantage because they don't travel. Their doctors are 5 minutes from their house. Their hospital is 5 minutes from their house.
And they're healthy.
And they're healthy. Okay? If you're not within 5 minutes of your doctor, 5 minutes of your hospital, Medicare Advantage might not be the best answer. Okay? Actual cost of care. Again, under original Medicare, your Medigap is going to pay 100% of your Part A. Your Part B, yes, you have a 20% coinsurance. But your Plan G, your Plan F, pays that on your behalf. So your actual cost is zero. Okay? Medicare Advantage. I go into a hospital with a Medicare Advantage plan. I'm there for 5 days. I have at minimum a $250 copay per day. So when I walk out, I get a bill, okay, for $1,000, $1,200. I walk out on Medicare, under original Medicare and a supplement. I have a bill. What's the bill say at the bottom?
Zero.
Yeah. Part B. I have a copay to see the doctor. I have a copay for the x-rays. I have a copay for the MRI. I have a copay for every service that I'm going to utilize. Now, here's the real kicker. Under Part B in original Medicare, and so, oops, no, I don't want to do that. Under Part B in original Medicare, we've got our deductible, right? I've already used it up. All right? But I now have to go to the doctor or the hospital once a quarter. Every 3 months, I have to go in. That charge is $1,000. Under original Medicare and a supplement, what's my cost? Zero. Thank you. Under Medicare Advantage, what's my cost? 20% of $1,000. What's my cost? Is my cost zero?
No.
My cost is $800. $800. 20% times 1,000. Okay? Times 4. That's why you have that maximum of 9,000. Where people run into problems are those people who have to go in for infusion therapy, cancer treatments. Okay? And Medicare Advantage now becomes expensive. Okay? So there's a difference, again, in how is it handled. And you're not going to know that unless you come to a meeting like this and somebody explains it to you. Because you don't read that in the paperwork. You read it, you see 20% coinsurance. But there's no math. Nobody's calculating it. Okay? All right. Rehab. Thank you. Rehab, durable medical equipment. I need a wheelchair. Can I get a wheelchair? Yeah. I might have to use a specific company to do so. Do I have to do that with original Medicare? No. I could probably go downtown. Might even be able to go to Walgreens, CVS. Okay? But Medicare Advantage, no. Again, I'm trying to point out that there are reasons for everything. Okay? Now, the adage has never been more true that nothing in life is free. Okay?
On that original Medicare, you've got underlined the approved amount after you meet the deductible. There still could be monies left over.
No.
There's
No.
some mine.
No. Let me do the math. I had an old boss who used to, you'd go in with a question and she'd say, do the math. And I go, I hate doing math.
I do too.
Okay? But here's the point. Approved means Medicare approved.
Right.
So, my $1,000 that I was talking about under Medicare Advantage, I'm paying 20% of the charge, $1,000. Over here, I'm paying 20% of the approved Medicare cost. So that $1,000 by Medicare standards is $200.
Yeah.
I just saved $800. Plus, I'm still at zero because my Part B deductible is already used up and my plan pays 100% of my benefit. So approved is actually a good thing. It's Medicare giving you the discount. Okay? Think of it as getting the Menards rebate up front. Something I cannot get across to my wife. That just because you get a rebate doesn't mean you go back to the store and buy more.
I don't want to bore you, but I'm a perfect example of that.
Okay?
In October, I had $125,000 neck surgery.
Right.
They only approved, it was here, they only approved $44,000, and that's what was paid, and I ended up paying nothing.
Exactly. That's the point. Okay? By the way, he's not a plant. All right? So I appreciate what you're saying. Got to turn it around. We got to make sure that we read the rest. Okay? The old adage of the fine print. It's not so much fine print as it is you just never have been taught the rules. You never needed the rules. Original Medicare and a gap plan with a Plan F, you didn't have to do anything. No? He just handed them the cards. No? Everything was done. Great. I'm glad. I'm glad you're here. All right? Questions?
Where is the Part G, or Plan G available? Where do you get them at? You said Medicare.
Medicare.gov. Any insurance agent in your community, okay, most insurance agents will sell you a Plan G. Okay? Now, you can call Blue Cross. You can call Humana. You can call United, ARP. Okay? And they'll sell it to you over the phone. Do I advise that? No. Okay? Get a good, look for an insurance agent in town. Okay? Probably because I was one of those guys, all those years. But number two, I want somebody that when something does go wrong, because things go wrong, I want somebody to help me. That's what that insurance agent does.
Some of them
Okay.
group too, like get you in the car and you're.
Right. Well, they can't do any discounts with Medicare. Medicare is a straight cost. Yeah. All right. So I've talked way too much, and I apologize because we've got to end this up. You can, in some cases, some people can get a Part B reduction. You can buy a Medicare Advantage plan that will actually reduce your $174 that you pay Social Security each month. But again, you're buying Medicare Advantage. Okay? Which road? That's the important part. What's right for you? Medicare Advantage works well for some people, mostly in larger communities, not rural. Okay? Most. Part D. Let me do this. All right. How many of you have experienced the donut hole? Okay. Great news. There is no donut hole next year. Gone. You now have a 3-tier program. Okay? You have an annual deductible, $590. By the way, it was $545 last year. Okay? So it only went up $45. So you have an annual deductible. Then the insurance company is going to pay 75% of the cost. You're going to pay 25%. So deductible, initial coverage. Okay? Until you spend a maximum of $2,000 out of your pocket. That's it. You cannot spend more than $2,000. Okay? I have some ladies that spend $2,000 a month right now. Yes.
Do we have a Med D?
Do you have to purchase a Medicare Part D plan? If you don't want to pay a penalty for the rest of your life, yes. Okay? It's cheaper to buy it than it is to pay the penalty.
It doesn't have to be a Medicare Part D though.
It has to be a Medicare Part D.
We have a supplemental drug plan. We don't have Medicare Part D.
Through work?
No. It's a well care.
That's D.
That's D.
That's D.
Doesn't matter.
WellCare.
Okay.
That's D. Yeah. Okay?
Do you have another insurance, say, from a work plan that has drugs? You don't have to. And you don't
Correct.
have to.
If you're still employed, you don't have to. Correct. Okay? But if you're not, then you have to.
Now, last year, the plan I had, suggested everybody go to the Part D, but I did not go to it because I have these pads that I use, and they're like $40 for 6 weeks.
Right.
For 12 weeks.
Right.
And I couldn't find those on the Medicare Part D.
Because they're not. They're under Part B. Yeah. So, again, one of the keys here is who are you getting help from? Ask. There are local representatives here at the hospital that will help guide you. Okay? At the end of this, I'm going to give you SHIP. SHIP. SHIP is the state health insurance plan for seniors. It's an 800 number. It's an email. It's a website. There are local representatives who are in your community or near you that will help guide you.
The SHIP counselors here in town at Chesterfield Senior Center, and they are taking appointments right now for open enrollment. So
Right.
make sure you give them a call.
Yeah, 14. You have 14 days to review. On the 15th, you can start enrolling. You cannot enroll early. Okay? Right, he's got to wait till January. All right, so the key is, once you hit that 2,000, you go into the catastrophic level. Now, there are a lot of people who are never going to get to that 2,000. A lot. But there are also people who are going to hit that 2,000 tomorrow. Okay? And that's the key. Because you're catastrophic, you're at zero. You're going to pay 25% and you're going to pay your deductible. Now, let's take a WellCare plan just for an example. That WellCare plan, in that annual notice, it's going to tell you that if you take only Tier 1 and Tier 2 drugs, your deductible is, the majority of people take Tier 1 and Tier 2 drugs. Those are generics. The kicker is Tier 3 and 4. 5 is specialty. Yes. Okay. Tier, in some specialty, cancer meds go back to Medicare under Part B, not D. Okay? So again, you have to read what you have in front of you. There are subsidies available. If you aren't or have not looked into, do I qualify? Please go to Medicare.gov. The link is right there, Part D-extra-help. And very quickly, you can determine, do I qualify? Somebody who's less than $30,000 a year in income probably will qualify. Okay? Probably. So if your retirement income is low, that's why these subsidies are out there. We also have a new program called Prescription Payment Plan. So if you know you're going to spend that $2,000, you can actually, with the help of your pharmacist, enroll into this prescription plan, and you're going to pay the insurance company, WellCare, on a monthly basis what you would spend up to the $2,000. So $180 a month? That easier than $2,000 at once? Sure. Okay? The goal is to help people on fixed income be able to afford their medications. We want people to take their medications. We don't want them cutting their medications. We don't want them skipping. Okay? This is a good thing. Now, somebody earlier said, is there any good in this? Yeah, your Part D changes are extremely good. Now, here's the negative. Said all the good stuff. Here's the negative. What is a formulary? A formulary is the drug list of approved medications by any one insurance company. It is governed by Medicare, meaning that WellCare and Blue Cross have to have similar formularies. Notice I said similar, not same. So you were talking about the patch, okay? The patch, it's not so much the patch as it is the reader. The reader is only approved by certain companies, okay? The patch comes along with it. So you have to look in the formulary list to determine what's available, okay? If all you are taking are generic drugs, no problem. You are not going to have any issues at all. But if you are on a Tier 3, which is what? A name brand drug. Tier 4 are all of those lovely drugs you're seeing on TV every 2 minutes. And if you have to take some of those are still expensive and may not be covered under the formulary. So what I'm asking you to do, that annual notice of change, that packet tells you specifically the changes that are coming. If you don't have it, if you can't find it, call the insurance company on the back of your card and they will send you another one. They have to by law. You can also find it online. So you can go to wellcare.com or .net, whatever it is, and you can look up the formulary there. So if you're with Blue Cross, you can do it on Blue Cross. United, doesn't matter. They're all available. But unfortunately, you have to do the work. Okay?
But you know, that's almost like this. I didn't quite get the email address out. Thank you.
Sorry? How many of you have a username and password at ssa.gov? Okay, again, go home and double check. SSA is Social Security Administration. You should have a separate username and password with them from Medicare. Okay? You can use the same password, that's up to you. Just make sure it's not tied to your bank. Okay? All right. Got it?
Yes, thank you.
All right. Somebody asked, do I have to buy a Part D? No. But let me give you an example. 3 years ago, I had a call from this hospital, had a couple. She suddenly was very sick. They were in their 70s. They had never had Part D. They couldn't afford the penalty, nor could they afford the medication. So, you can buy a drug plan. If you are taking no meds, you can buy a drug plan in 2025 for no premium. But, go ahead.
This is a sneaky question.
Can I buy a plan that doesn't cover anything to avoid the penalty, whether I'm on prescription?
Yes. You can buy a Part D when you're eligible. So are you, when are you eligible?
Already got it.
All right, if you've got it, then you don't have to worry about it. No. And in some cases, you can go and get a prescription using GoodRx
Yes.
less expensively than the Part D.
That's my point.
Yeah.
And can I buy a Part D now?
I cannot answer that because I don't know exactly what you have through your work. Okay. Right, but there's 50 different plans for the federal government. So you'd have to call them, okay, or sit down with a SHIP counselor, okay, and they would help walk you through that. Okay. Legally, I can't. I'm here as an educator.
When does original Medicare begin for us that are turning 65? Is it the beginning of the month of your birthday or the following month?
As long as your birth date is not the first day of the month, it starts the month, that first day of the month.
Of the birthday.
Right. But if your birthday is July 1, your Medicare actually starts June 1. Okay? Goes back a month. But if you're July 4th, okay, it's July 1. If you're July 24th, you're July 1. Okay? Very important again. All right? Because in Medicare, again, original Medicare, you have the 3 months before your birthday, the month your birthday, the 3 months after your birthday. 7 months total that you can enroll. If you miss 7 months, you're waiting until January of the next year, and you'll get a March 1 effective date. Okay?
Does original Medicare cover telehealth visits next year?
Great question that I don't have a 100% answer. Normally, yes. Okay? I have not had a problem with that.
Not
Yeah.
any changes on that?
No. Well, original Medicare is paying for telehealth. I haven't seen anything that's changing that law. Okay? So where you run into more problems with that is the Medicare Advantage. Okay? You're not required to take Medicare Advantage, no matter what those television commercials tell you. Okay? Remember, those television commercials are national. All right? 2 months ago, I sat with a VP of United, And he asked what they could do different. And I said, stop advertising plans in Illinois that nobody can buy. And then I found out a trick that they're doing that I am furious about. And I'm not going to go into that today. Okay? You have to look. Medicare Advantage may be good for you. I can't answer that. It's how much are you going to use it? Are your doctors participating? Is the hospital participating? In that packet that is in front of you, at the very beginning are the plans that Medicare Advantage and Paris Hospital participates in. See that green, light green color says participates? You'll notice that there are only a handful of companies. Humana, Health Alliance, Blue Cross, not United. Okay? United doesn't want to be nice. Can I get out? Yes. January 1 to March 31, you can make a change. If you're losing Medicaid, gaining Medicaid, you can change. If you're moving one county to another, one state to another, you have to change. If that county doesn't have the same plans as your county, which is the case.
If you're on original Medicare,
No.
you don't have to change anything.
Nope. Just call them and make sure they got your right address so you can send them a premium. Yeah. Okay? ID cards. Normally I would go through this, but we've already run way over, so I'm gonna skip this. But ID cards are important because of these. This is the confusion. These are not your insurance card. These are a preloaded fund so that you can go and get over-the-counter things. So some of the Medicare Advantage plans have these. Not original Medicare with a supplement. You will never have this with original Medicare and a supplement. This is only Medicare Advantage. Okay? United has, again, confused the issue because they have a combination card called a U card. And that U card does both. Thank you, United, for making things difficult. Okay? Identity theft and fraud. Do not give out your Social Security number to anyone. You have to give your card at the doctor's office. They scan it, they give it back to you. Your Medicare card, the same. Your insurance ID card, the same. Do not give it out. Okay? Fraud is huge. Now, I just had one of my employees with her mom have an issue where a durable medical equipment called up asking mom all sorts of questions, trying to get information to falsely bill Medicare and her. Illegal. You get a call from somebody that you don't know, ask them for their ID number, ask them who they are from, and then call 1-800-Medicare and report them. I want them off the street. Probably. The same with insurance people. You are not supposed to get a random call. How many of you have gotten a random call? They're all illegal. The only one who can call you is your insurance company or your insurance agent. And your insurance agent, by law, is not supposed to call you. You are supposed to call him. So if this happens, again, 1-800-Medicare.
Medicare don't call you either.
No. Medicare, Social Security will not call you. Ever. Ever, ever, ever. Okay? You can call them, and if you talk to anybody at Medicare, you talk to anybody at an insurance company, you ask them for a reference number for the call. Extremely important. Get a reference ID so that you, if something is still, you're not getting the claim paid, you're getting whatever it might be, now everybody has a reference point to go back to. Extremely important. Yes?
If you've been getting these calls from these things, and somebody like they've got some information from you, will the fraud show up on the little form that, in other words, the little form you get from Medicare once a quarter or whatever, it'll show up and you look at it and you can go, why is that there? I didn't get that.
Or again, Medicare.gov, another reason to have access to your Medicare.gov account. Yeah. If it's been caught, the problem is we have billions of dollars not being caught. Okay? So again, I always make sure we talk about this. Some links. How can I get some help? Right here at the hospital. They have people that are here every day. Okay? I just get to pop in once a year. Medicare.gov, extremely important. Social Security. IllinoisAging.Illinois SHIP. Again, you have local representatives who are right here in town at the senior center. Okay? They are not going to enroll you. They cannot, legally. They will compare. They will give you suggestions. They will help you understand it. But they will not enroll you. They will not complete the paperwork. They will not go onto the website and do it for you.
They will hand you the comparisons and say, go talk to your doctor, go
Right.
talk to your nurse.
Right. Go talk to your grandson so he can help you set up the account. Okay? And then I put Indiana on there too. SHIP is nationwide. Every state has a SHIP agency as part of Illinois Aging. Okay? I apologize for going way over, but I hope that you enjoyed some of the meeting.
Oh, you did a great job. Quick question. I have a Part D, and you're right. If you're in Tier 1 or 2, you're in business. I've recently had to have a Tier 5, and that just has killed me.
Correct.
GoodRx only helps you occasionally.
Correct.
What
Correct.
other kind of things like that are there available?
Well, the most important thing right now, because it's open, it's annual enrollment, is going to Medicare.gov and putting in your drug information, and then you can do a research comparison of every formulary with every company to determine whether that drug is covered and at how much. So it's all on Medicare.gov.
But if it's a Tier 5 on,
It's still
say, WellCare, it's going to be a Tier 5 every place.
not necessarily.
Really?
No. There are Tier 4s with some companies that are Tier 3 with other companies. There are Tier 5s that are Tier 4s. There are Tier 4s that'll be Tier 5. So it depends on the insurance company's formula.
I've got WellCare, how do I?
Medicare.gov, okay, and follow the directions. Okay, you can enter your medications and do a comparison. Okay, if you give me 5 minutes to get everybody disposed, I'll show you how. Okay.
Go ahead, go ahead.
Everyone, thank you for being here. If you have questions, I'm here. So I'm not running out the door. Okay, so bear with me a moment.